Rheumatoid arthritis is a chronic autoimmune disorder primarily affecting joints, but it can also impact other organs. In RA, the immune system mistakenly attacks the body's tissues, leading to inflammation and damage, most commonly in the joints of the hands, wrists, and knees. This condition is progressive, meaning symptoms can worsen over time, and early diagnosis and treatment are critical to managing it effectively. Overview: Prevalence: RA affects about 1% of the population worldwide, with a higher prevalence among women than men. It often begins between the ages of 30 and 50, although it can start at any age. Nature of RA: RA is characterized by periods of flared UPS when symptoms worsen and remission when symptoms improve. Causes and risk factors: the exact cause of rheumatoid arthritis is unknown, but a combination of genetic, environmental, and hormonal factors is believed to contribute. Risk factors include genetics. Specific genes, such as HLA-DRB1, are associated with a higher risk of RA, especially in those with a family history of autoimmune diseases. Gender: RA is more common in women, possibly due to hormonal influences. Environmental triggers: certain infections, smoking, and exposure to toxins may increase the risk. Lifestyle factors: smoking is a significant risk factor, particularly for those with a genetic predisposition. Obesity and certain diets may also play a role. Symptoms of RA can vary widely but typically affect multiple joints in a symmetrical pattern both sides of the body. Common symptoms include joint pain and stiffness, most noticeable in the morning or after periods of inactivity. Swelling and redness, due to inflammation in the joint lining synovium causing visible swelling. Loss of joint function and deformity. Over time, chronic inflammation can lead to joint damage and deformities. Fatigue. Persistent fatigue and malaise are common, often accompanied by low-grade fever. Other symptoms: RA can affect other organs, leading to issues such as dry eyes, lung inflammation, cardiovascular problems, and rheumatoid nodule small lumps under the skin. Diagnosis of RA involves a combination of physical examination, medical history, and laboratory tests. Physical examination: a physician will check for signs of swelling, tenderness, and limited range of motion in the joints. Blood tests: common blood tests for RA include rheumatoid factor (RF) and anticyclic citrullinidine peptide anti-CCP antibodies, which are often elevated in people with RA. Erythrocyte sedimentation rate (ESR) and C-reactive protein (CRP), which measure inflammation levels. Imaging tests: X-rays, MRI, or ultrasound can detect joint damage or inflammation and help monitor disease progression. Treatment: while there is no cure for rheumatoid arthritis, early intervention with a combination of medication, lifestyle changes, and therapies can help manage symptoms and slow disease progression. Medications: non-steroidal anti-inflammatory drugs and SAIDs help relieve pain and reduce inflammation. Corticosteroids provide quick relief of inflammation and are often used short-term to control flared UPS. Disease-modifying antirheumatic drugs (DMARDs) slow disease progression. Methotrexate is commonly used as a first-line DMARD for RA. Biologic agents target specific components of the immune system, such as tumor necrosis factor TNF inhibitors e.g., etanercept, adalimumab, and interleukin inhibitors e.g., tocilizumab. They are often used when traditional DMARDs are ineffective. Janus kinase JAK inhibitors, the newer class of medications for moderate to severe RA, including tafasitamab and baricitinib. Physical therapy and occupational therapy. These therapies can help improve joint function, flexibility, and strength. Occupational therapy also teaches ways to protect joints and manage daily tasks more comfortably. Lifestyle changes. Exercise. Regular, low-impact exercises e.g., swimming, walking help maintain flexibility and strength. Healthy diet. A diet rich in anti-inflammatory foods, e.g., fruits, vegetables, whole grains, and omega-3 fatty acids, can reduce inflammation. Weight management. Maintaining a healthy weight reduces strain on joints. Smoking cessation. Smoking can exacerbate symptoms and reduce the effectiveness of ORA medications. Surgery. For severe cases where joint damage is significant, surgical options may be considered, including joint replacement, tendon repair, or joint fusion. Complications. Without proper management, ORA can lead to several complications. Joint damage and deformities. Persistent inflammation can destroy cartilage, bone, and joint structures. Osteoporosis. Medications like corticosteroids, combined with reduced physical activity, increase the risk of weakened bones. Cardiovascular disease. ORA is associated with an elevated risk of heart disease and stroke due to chronic inflammation. Lung disease. ORA can lead to lung inflammation or fibrosis. Infections. Medications that suppress the immune system can increase infection risk. Prognosis. With early diagnosis and treatment, many people with ORA can manage their symptoms and prevent significant joint damage. Outcomes are highly individualized. Factors like age, disease severity, treatment response, and lifestyle all play a role in prognosis. Remission. The period with minimal or no symptoms is achievable for many, though ongoing monitoring is essential to manage flares and adjust treatment as needed. Conclusion. Rheumatoid arthritis is a complex autoimmune disorder requiring a multifaceted approach to manage effectively. Early diagnosis and treatment are crucial for slowing disease progression and improving quality of life. With advancements in medications and a focus on comprehensive care, individuals with ORA can lead active, fulfilling lives. Regular follow-up with healthcare providers, lifestyle modifications, and adherence to treatment are key components in successfully managing this condition.